Hi everyone, my name is Hiten Patel. I'm one of the third year family medicine residents at Ohio State University, and I did a small project with Rebecca Rings, who's a medical student at Ohio State, as well as Dr. Beth Pancho, who is Associate Program Director at Ohio State Family Medicine. Our study was called Point of Care Ultrasound Education and Family Medicine Residency, with an example from Ohio State University. And there is our Twitter information in case you want to reach out to us, and then my email address is later on within the PowerPoint here. So, a little background on why we did this study. So, as everyone attending this conference and virtually attending this conference knows, point of care ultrasound is pretty prevalent within medical education and within residency training. Medical schools are starting to establish robust medical student ultrasound programs. Within Ohio State, for example, we have a program where students are exposed throughout all 4 of their years. Lots of emergency medicine programs have strong ultrasound training in addition to having fellowship programs. And even internal medicine programs are going beyond just procedural based ultrasound. So that all to just say that a lot of medical students and residents in other specialties are being trained on POCUS, and in family medicine that necessarily isn't happening as at quite a level, but it's starting to change. So a study in 2015 from Paul Borneman et al. Showed about 2.2% of family medicine residencies had developed ultrasound curriculum. Now that's changed in time. There hasn't been a large enough study done again to see how programs are utilizing ultrasound at this point. But lots of programs have curriculums, and there's some websites even. And the AFP, which is the American Academy of Family Physicians, has actually started developing a lot of ultrasound groups as well as educational material. So, in terms of primary care applications, there are several. Obstetrical applications are obviously there within family medicine, so getting dating ultrasounds, fetal heart tones, position, as well as more complex care if you are an obstetrician. Cardiac ultrasounds would be very useful in family medicine, specifically to see if there is a gross reduction in ejection fraction in someone who's coming into the office short of breath. Again, these aren't meant to replace full echocardiograms, but they're meant to help triage and determine if a patient needs to be seen earlier versus if a patient needs to have a diuretic on board. Musculoskeletal ultrasound is going to be a large component of what primary care doctors use ultrasound for, specifically in sports medicine applications, lots of knee injections, shoulder injections, hip injections, as well as smaller joints. However, that's more focal, specialized within sports medicine physicians. And pulmonary ultrasound, looking for effusions and looking for signs of pneumonias would be very useful in family medicine as well. So what this study meant to demonstrate is that POCUS education can happen in various ways, and we studied one approach to POCUS within our residency program with collaborating within our departments here at Ohio State, including the emergency medicine department. So the way we went about our education was to do workshops. So we specifically studied during this study 2 specific workshops that we had. Each of those workshops were 4 hours long. The first hour of both of those workshops started with a short lecture on a specific topic. So the first lecture was on knobology and the basics of the physics of ultrasound, and then the second lecture was an OB ultrasound lecture, giving just kind of the basics about what the positioning and positioning is within the ultrasound scan. And so the following 3 hours of each of those workshops were a practice scanning session where we had proctors and trained models who were present so that all of our residents could scan and practice. And we also incorporated bingo sheets and sheets where residents could find specific structures and mark them off. So we had residents from all 3 years participate, first years to third years, and prior to the workshop, a pre-test was given, and after the workshop was completed, a post-test was given. Both of these were done through Google Docs. These questions were taken actually from the medical student curriculum at Ohio State in ultrasound. And then at the end of the questionnaire, the workshop quiz, there was a question on confidence of POCUS skills, with 1 being not confident at all to 10 being an expert. And finally, after these results were collaborated and compiled, a paired t-test was done on the pre-test and post-test scores, as well as the confidence that the operator felt they had. So here are some sample questions, just so you get an idea of what types of questions were asked. So on the left, you can see identification question. valves, and then on the right you can see a couple questions there based on just more so the image acquisition portion of what black versus white looks like. There's some pathology, for example, with the middle question on the right, asking about what positive bar signs mean. And then at the bottom, asking more about operator decisions that need to be made, so which probes are best for which specific scans. And so there's a broad array of questions that were asked in these pre and post tests. So workshop 1, results from that. So workshop 1 was more so a basic ultrasound overview with knobology and physics, and then we did a little bit of scanning in cardiac, fast, and renal ultrasound. Just a background on the residency program in general, we have 27 residents total, 9 residents per class from PGY 1 to 3. And below are the results. So our first year class had pretty good response rates for the pre-test and the post-test, although you can see some drop off in terms of the respondents. And in total, we only got 18 respondents for the pre-test and 12 respondents for the post-test. That being said, there were a few residents who were not present during the workshop. But you can see that the pre-test, post-test scores, there's a slight difference at the total score for all residents combined. But there's not a significant difference, which we'll get into in the next slide. And in terms of confidence, there's an increase in confidence across all PGY levels as well as overall. So in terms of p-values, there was really no statistically significant result in p-values for changing of score. And in terms of changing confidence, there was certainly an increase for PGY1, PGY2 residents for being more confident in their scanning abilities. On average, it was an increase of 0.83, which is difficult to say if that's clinically or academically significant. Workshop 2 was specifically on obstetrics, so we did pelvic ultrasound, transvaginal ultrasound, dating ultrasounds, and had a lecture at the beginning of the workshop to give an overview on those scans themselves. So you can see here that for the pre-test, there were a total of 10 respondents in the PGY1 class and 7 for the post-test. That 10, we think, was higher than 9, which is the number of residents in that class, because one of the respondents responded twice. And then you can see the drop-off in response rates from PGY2 and PGY3 residents, with PGY3 residents only having a few respondents on each of those post and pre-tests. And then the total number of respondents that we had was 16 and 13. Again, the residency class is 27 total. And the score really wasn't that much more different from the pre-test and post-test. Again, the confidence did increase. And if we go back, the pre-test to post-test increase for all residents went up from 1.84 to 2.67. There was about a 2-month period between workshop 1 and workshop 2, and the confidence you can see here actually dropped below what was that present at the beginning, or sorry, at the end of the first workshop, but then rose again to 3. And so this slide again takes a look at if there was any statistically significant values. So really what I wanted to focus on again is just the total, all 3 classes combined. There's really no difference in the change of score, and then there was some difference in the change of confidence, a 1-point value, so 10% of the possible 1 to 10 range, statistically significant to 0.001. So in terms of our results specifically, what we wanted to assess was to see if workshops improve knowledge and confidence in point-of-care ultrasound training and family medicine residents. And our study, I think, was a good start to looking at the data, but I do not believe that any large conclusions can be drawn from our study, specifically because we had a very low number of respondents both for pre-test and post-test, as well as inconsistent data from specifically the second workshop that we had. It's really difficult to say whether or not the pre-test versus post-test score truly means anything in terms of knowledge, but there certainly was no statistically significant difference, so there's no question of whether or not we should actually take these results as a positive. And then there was some evidence that the confidence of POCA scale did increase. So overall, what I think I took away and what I think my colleagues took away as well was that workshops can lead to exposure, and that's more likely that our residents will have confidence, but it's not very likely to increase all of the components that are needed in order to utilize POCUS. So, what I mean by that is there still needs to be frequent knowledge checks and studying in order for residents to develop the true POCUS skill. So, workshops combined with studying knowledge and then practicing will lead to true POCUS skill. So there are many approaches to POCUS training in non-EM specialties such as family medicine. One approach would be to collaborate with EM POCUS faculty and strong internal medicine programs as well. This can be combined with open source education, such as utilizing 5-Minute Sono or any of the other ultrasound free resources that are available. Butterfly IQ now has its own source of education as well. So these two can be combined, and ultimately the way that family medicine programs and non-EM programs will start developing a stronger program in POCUS is by training family medicine POCUS fellows and family medicine attendings who are actually trained in POCUS. And so thankfully I can say that our collaboration with the emergency medicine program at Ohio State led to the development of a primary care ultrasound fellowship. And I think that this will be key in bootstrapping our department and our residency program's ability to not only hold additional workshops, but have specific focused patient scan sessions within our clinics that are more geared towards primary care, as well as recurring didactic lectures that can provide some more education on a recurring basis about POCUS. So that was a little overview on our presentation. I'm happy to take any questions. My email is there, or feel free to send me a message on Twitter as well. I want to give a special thanks to two of our ultrasound faculty at Ohio State, Dr. David Boehner and Dr. Craig Bolger, who were very supportive and also provided a lot of education during this workshop and also the research as well.